Today we are going to talk about idiopathic normal pressure hydrocephalus. What is it and how common is it? When we talk about adult hydrocephalus, we talk about four categories or clinical groupings. There are those that are transitional. Initial treatment occurred when they were children. There are those that were unrecognized, but they were born with it, unrecognized congenital. There was no treatment as a child. These patients are recognized as adults. There are those that are acquired, such as with subarachnoid hemorrhage, trauma, infection, or brain tumors. And then the fourth category is idiopathic normal pressure hydrocephalus, or iNPH. And for this category, patients are expected to be at least 60 years of age or older. Idiopathic normal pressure hydrocephalus was first described by Dr. Solomon Hakim in 1965. Dr. Hakim described three clinical symptoms that went along with NPH. They were unfortunately relatively nonspecific. They included a balance or gait disorder, cognitive impairment with dementia when things become more severe, and urinary frequency or urgency, and sometimes incontinence. And importantly, with this disorder, in the presence of large ventricles, treatment with a shunt improved outcome. This is a cartoon to illustrate what a shunt does. The shunt moves fluid from the ventricles through the tubing with a valve down into the peritoneal cavity. There are different types of shunts, but this is the most common shunt that is used in North America. After Dr. Hakim identified NPH in 1965, there was an initial exuberance which was almost irrational, trying to treat everybody with these symptoms. And this led to a lot of problems because of incorrect patient selection. So there was a lot of skepticism generated. But over time, significant research has been done, and a renaissance has occurred in our understanding of how to approach the investigation and treatment of patients with NPH. We have diagnostic guidelines. We look at the clinical assessment. We do testing to record the cognitive function, the walking and balance, and questionnaires to assess urinary dysfunction. We use imaging such as CT scan or MRI scanning to identify the ventriculomegaly, the large ventricles in the brain, and then we do tests to mimic the effects of a shunt, either with a large volume lumbar puncture or an external lumbar drain where we remove fluid on a regular basis over several days. With this process of mimicking a shunt, if we find an improvement in these symptoms, it indicates that a shunt may be of benefit for these patients. So we now have a much better approach for the diagnosis and treatment of NPH. So how common is hydrocephalus? We did a systematic review, which means we looked at all the medical literature over several decades, trying to define these numbers. And we were able to define these numbers in different ages of patients. With regards to NPH, idiopathic NPH, the prevalence was found to be about 175 per 100,000 over those greater than 65 years. Now, I mentioned that you can be over 60 for this diagnosis. However, it appears to become more common as you get older, so it may be as high as 5,000 per 100,000 over the age of 80 years of age. And this was a paper published by a Swedish research group in 2014, suggesting that 5.9% of those over the age of 80 could have iNPH. But even if we use lower numbers, if we use the 400 rather than the 5,000, This is more common than brain tumor and more common than multiple sclerosis. Just focusing on the issue of idiopathic NPH, a new study has been published, again out of a group from Sweden. What they showed was that the prevalence of iNPH was 3.7% among individuals 65 and older. So that translates into even greater numbers than we identified from the systematic review, which was looking at older studies. And why is this important? We have a population that is getting older. Here is a graph representing the population in Canada, showing that the number of those over the age of 65 is growing steadily by decade. So here we are in 2020, and the numbers are getting higher. Let's look at the prevalence of iNPH in Alberta and Canada, and we'll use some numbers from 2016. The prevalence number that we've used is 175 per 100,000 for those over the age of 65. And this is probably an underestimate of the numbers because we've already shown that the prevalence increases with age. So we have the known numbers of people over the age of 65 in Alberta and in Canada increasing in 2040 to almost 1.1 million in Alberta and 11 million in Canada. So that means that in 2016 there were just under 1,000 patients with iNPH, and this number is going to almost double by 2040. And in Canada there's about 10,500, and this will again almost double by 2040. And the unfortunate thing that we'll come to talk about in a minute is that only a fraction of these patients are identified and treated. This is important because the natural history of iNPH untreated is quite poor. Mortality and morbidity rates are high. What happens with iNPH is that people fall because of their balance problems. When people fall, they can fracture limbs, they can damage different parts of their body, they can experience head trauma. Hip fractures can be a serious complication of falls, and the mortality associated with a hip fracture in someone over the age of 70 to 75 is approaching 50% after the first year. This is a quote from a small article that was written, "Why Hip Fractures in the Elderly Are Often a Death Sentence." 1 in 3 adults aged 50 and over dies within 12 months of suffering a hip fracture. Older adults have a 5 to 8 times higher risk of dying within the first 3 months of a hip fracture compared to those without a hip fracture. Falls are a serious health issue in patients with iNPH. In this paper, published from a group in Sweden, they looked at the mortality and the risk of dementia in patients with normal pressure hydrocephalus. They showed that when patients had this diagnosis but weren't treated, that the 5-year mortality was almost 90%. That is significantly higher than the normal age group. So what we have is a disorder that carries a lot of risk, a lot of morbidity, a lot of risk for early death, and frequently unrecognized and more common than people think. So what are the implications for the future? The population impact of iNPH is huge. We've talked about the numbers of people in Alberta and in Canada who have this disorder and will have this disorder. And these are some numbers extrapolating from U.S. Estimates. They estimated that there were over 700,000 people in the U.S. who might have NPH in 2010. However, they also noted that for patients over the age of 65, there were only 5,000 for shunt operations per year. So if one looks at 700,000 people with the disorder and 5,000 people being treated on an annual basis, that means that there's a huge gap in the identification and treatment of people who have iNPH. If people stopped getting iNPH, and as of 2010, they only started to treat the people who had it, at this shunt rate in the United States, it would take 140 years just to shunt the people who had NPH at that time. So we are not winning this battle. More needs to be done. More advocacy needs to be done. And they also showed that significant healthcare dollars could be saved by treating people. Shunting actually can be very beneficial for patient outcome, but can also save our healthcare system a lot of money. And so these are the points that we have to drive home about iNPH. We have to make sure that people are aware, the government is aware of how critical this disorder is and how much can be done to help patients, and the overall impact this has for patients, for families, and for the healthcare system. I hope you have found this presentation informative. Thank you.